Hello everyone, welcome to my channel. Today we will talk about high blood pressure during pregnancy. We will discuss what is the reason for its high, what are its symptoms, what harms does it do to a woman's body, how we can control it naturally. This video is very important, so do not skip any part of the video. Let's go to the main topic of the video. High blood pressure during pregnancy is called preeclampsia. Pregnant women who experience high blood pressure, protein in their urine, and swelling in their hands, feet, and legs are said to have preeclampsia, also known as toxemia. Mild to severe variations are possible. Third, it can occur sooner or right after birth. It typically occurs in the later stages of pregnancy. Eclampsia, a dangerous condition that can pose health hazards for mom and baby, and in rare instances result in death, can develop from preeclampsia. You have eclampsia if preeclampsia causes seizures. Preeclampsia can only be cured by giving delivery. Preeclampsia symptoms can last for up to 6 weeks even after birth. By becoming familiar with preeclampsia symptoms and scheduling routine prenatal visits with your doctor, you can take steps to protect yourself. Early detection of preeclampsia may reduce the likelihood that both mom and baby will experience long-term issues. Preeclampsia symptoms. Preeclampsia symptoms including swelling, protein in the urine, and blood pressure 140/90. A significant increase in body fluid over the course of 1 or 2 days causes weight gain. Shoulder hurt, lower right side of the upper abdomen hurts, bad headaches, reflex or mental state modification, having minimal or no urinating, dizziness, difficulty breathing, severe nausea and vomiting. Vision alternation include flutters, flashing, flashes, or fuzzy vision. Preeclampsia can affect some women without any symptoms. Therefore, it is crucial to visit your doctor for routine blood pressure check and urine testing. When do symptoms show up? Although it is uncommon, preeclampsia can develop as early as 20 weeks into a pregnancy. After 34 weeks, symptoms frequently start. In a few instances, symptoms start to appear soon after birth, usually within 24 hours. They typically disappear on their own. Preeclampsia causes. Preeclampsia and eclampsia are brought to occur when a woman's placenta does not function properly, although the specific cause is unknown. Some speculate that it might be caused by poor nutrition or high body weight. The uterus' inability to receive blood flow could be a factor. Genes also play a role. Other hypertension disorders during pregnancy. One of 4 blood pressure problems that can occur in pregnant women in preeclampsia. The remaining 3 are gestational hypertension. This type of high blood pressure develops after the 20th week of pregnancy, but it does not result in a lot of protein in the urine of the pregnant lady. Usually it disappears after delivery. Chronic hypertension. Before a woman becomes pregnant or before the 20th week of her pregnancy, this type of elevated blood pressure develops. Chronic hypertension with supreme post-preeclampsia. This type of persistent hypertension worsens over the course of pregnancy, increasing the amount of protein in the urine and leading to various issues. Preeclampsia risk factors. The following factors can raise your risk of developing preeclampsia: being a teenager or an older woman, African American, having one's first pregnancy, having children at interval of less than 2 years or greater than 10 years, pregnancy with a different spouse than the child's biological father, high blood pressure prior to conception, having a preeclampsia history, a sister or mother with preeclampsia, a background of obesity, carrying many infants, in vitro conception, diabetes, renal illness, lupus, or rheumatoid arthritis in the past. Preeclampsia complications. Your placenta may not receive enough blood if you have preeclampsia, which could result in a very small baby at birth. Fetal growth limitation is what is meant by this. The consequence that might result from premature delivery, including a learning difficulties, epilepsy, cerebral palsy, and hearing and vision issues, are also among its most frequent causes. Preeclampsia can result in uncommon but serious problems such stroke, seizures, and accumulation of fluid in your chest, heart attack, permanent blindness, Your liver is bleeding following delivery. Condition known as HELP syndromes can develop when preeclampsia or eclampsia harms your liver and blood cells. That signifies hemolysis. When this happens, your body red blood cells, which carry oxygen, start to degrade. Elevated liver enzymes. These compounds indicate liver issues when they are present in high blood levels. Low platelet counts. This occurs when your body lacks sufficient platelets, preventing your blood from clotting properly. The medical condition HELP syndrome is urgent. If you have any of the following symptoms, call your doctor or visit an emergency room. Hazy vision, belly or chest pain, headache, fatigue, stomach pain and vomiting, swelling in the hand or face, bleeding from the nose or gums. Placental abruption, commonly known as preeclampsia, is the sudden separation of the placenta from the uterus. This might result in a stillbirth. Preeclampsia diagnosis. If you have high blood pressure and at least one of the following additional symptoms, you may have preeclampsia. Pee with too much protein in it, insufficient platelets in the blood, high blood levels of kidney-related compounds, high blood levels of liver-related compounds. You have lung blood, a fresh headache that does not go away after taking medicine. Your doctor might order tests like the ones listed below to confirm a diagnosis. Blood tests to examine your platelets and look for substances produced by the kidney or the livers. Testing urine for protein. To monitor your baby growth, you can use ultrasound, non-stress tests, or biophysical profile. Preeclampsia treatment. Giving delivery is the only way to treat preeclampsia and eclampsia, depending on how far along your baby is, how healthy your baby is developing inside of you, and the severity of your preeclampsia. Your doctor will discuss with you when you give birth. Your doctor might recommend including labor or performing a cesarean section if your baby has grown well, usually by 37 weeks or later. By doing this, preeclampsia will not worsen. You and your doctor may able to manage moderate preeclampsia if your baby is not yet near to term until the time comes for a safe delivery. The better it is for your baby, the closer the birth comes to your due date. Your doctor might advise the following if you have mild preeclampsia, commonly referred to as preeclampsia without severe features. Rest in a bed, either at home or in a medical facilities, primarily on your left side. Numerous ultrasound and careful monitoring with a fetal heart rate monitor. Drugs that reduce blood pressures, urine and blood tests. In order to closely monitor you, your doctor could advise that you remain in the hospital. You might obtain in a hospital medication to decrease blood pressure, stop seizures, and stop other issues. Doses of steroid to hasten the development of your infant's lungs. Even if you are not yet close to term, your doctor might need to deliver your baby immediately away if you have severe preeclampsia. After that, preeclampsia symptoms should go away in 1 to 6 weeks. However, they could continue longer. Preeclampsia prevention. Consult your doctor about changing your lifestyle if you are more likely to develop preeclampsia so that you can stay healthy. You may have to, if you are overweight, reduce your weight, quit smoking, regular exercise, control your blood pressure or sugar level. Additionally, your doctor might advise you to take 180 milligrams low dose aspirin every day. However, consult them before taking any supplement, vitamins or drugs. And that's enough for today's videos. If you have any question in your mind or any disease is growing in your area, then message me on Instagram and I will guide you completely. Thanks for watching.